Yo, Savage Psychotherapist. Today, I'm going to do an opinion video. I don't ever want to deal with political things, but this topic is something that I want to address head on. And I think at its core, it is not a political video or a political message. It's a clinical one. There are plenty of other sensible people out there who share this kind of sentiment, and I want to add my voice to their ranks. My opinion of the day, being liberal, progressive, left-leaning, or having a postmodern bent to your worldview is not the equivalent of being a good therapist. There shouldn't be any kind of politics in clinical mental health treatment. It doesn't make you a good therapist. I would even argue that it would make you a bad one. I've seen people with that worldview be some of the most biased, prejudiced, discriminatory people that you could imagine. I was once told that I should go to hell and die because I said that I believed that children who were sexually abused by child molesters were more important and more vulnerable than the child molesters and pedophiles themselves. So then I was told online by some random person who was a therapist that I was a terrible therapist and I should burn in the fires of hell or something to that effect. I've seen other examples of things like that. At least so far in America, people are free to choose their worldview. But having a worldview or a belief system, like a political worldview or belief system, is not a clinical therapeutic framework. That's not where that comes from. Everything that I know about treating depression, anxiety, sleep issues, relationship problems, post-traumatic stress disorder, personality disorder issues, and any number of other kind of problems that people might bring in had nothing to do over the years with any social work policy classes or any of those kind of things. That was just stuff that you had to get out of the way in order to learn how to be a clinician. So any program that's out there that is training clinicians, politics needs to be separated from clinical training. From the perspective of a client or a patient, you should be able to glean a therapist's political orientation to the same level that you would be able to glean the political orientation of a emergency room doctor who's patching up a stab wound. Meaning, if they don't say it out loud, all you'd be doing is guessing. It shouldn't even be a factor. You shouldn't know. You should have no idea. A friend of mine shared this experience with me on a social media community group or forum for therapists. And he said that I could share this story in this video. There was some therapist on this group that was talking about a hypothetical patient, and she described the patient as a typical heterosexual conservative white male presentation. Typical heterosexual conservative white male presentation. The disdain and contempt just oozes off of that like sap from a maple tree, just saying something like that. And she said that out loud in front of other people. And it was even met with acceptance and reinforcement and little challenge. My friend challenged it, and then he was dismissed from the group for being abusive. But could you imagine if I described a client as a typical liberal black female presentation? Could you even imagine? No way. That's insane. People who hold that type of worldview should not be mental health clinicians. A person who would describe somebody like that should not be a mental health clinician. I understand if you have a client who's done some horrific things, like abused children or something like that, but just a random dude who's like, I can't sleep and I got anxiety over things, and you're going to refer to him that way, you should not be a clinician. Go do something else. Go work at a 501c3 nonprofit company, or go work for some community resource center, or get involved in some kind of social justice grassroots thing if you want. But stay away from clinical therapy. Stay away from clinical work. Go do something else. The problem with social work as a field of study is that it's a mile wide and an inch deep. There's so many different things in there that a person can do. You know, like if I were to tell somebody I'm a social worker, which I don't do, I don't tell people I'm a social worker. I tell people that I'm a therapist, or I tell people that I'm a behavioral health provider. I don't tell people I'm a social worker because there are so many broad things that people can get involved in the field of social work. You know, policy. If those are people's interests, go do that. Go do that. Don't get involved in clinical work because your biases are going to show and you're going to have impact on people's lives that you probably shouldn't have. Go look at a video on YouTube with the comedian Matt McCusker titled Matt McCusker on his time as a high school counselor. Watch that from about 2 minutes on and listen to the descriptions of some of the people in his social work program. None of those people should ever have access to vulnerable mental health clients, period. Then go into that video and look at the comments. Some of them are therapists. This is what made me happy. Some of those people identified themselves as therapists. Some of them identified themselves as people who went to some kind of social work school. You'll see how ridiculous they also think those kind of people are, which makes me feel good in my heart because those people are ridiculous. It's like they're cartoon characters to me. I hate imagining that people like that are actually out with influence over emotionally and psychologically vulnerable people. That kind of terrifies me that people like that can have that kind of level of influence over someone. It's wild. This is a good time for me to bring up a quote from my better half. I keep a running list of quotes from my wife on my phone just because she's witty and she says all these awesome things. I think they're hilarious and also genius at the same time. But here's one. That therapist lady with severe anxiety, self-esteem problems, and 10 cats who only leaves her house to have an appointment with you cannot help you. Spot the hell on. Luckily, in my life, I've not come across many real-life therapists who hold that worldview, but I know that they're probably being churned out at higher levels in academic institutions and liberal arts colleges and in social work programs. So I know there's going to be a swell of people with that political view or mentality that are going to go out into the landscape. Most of the therapy professionals that I've ever encountered are sensible people. Not all of them. There are clearly a lot who have a lot of problems. Those types of individuals is a whole nother level of messed up. And there's going to be a swell of those people who've been brainwashed under the banner of that type of insanity. And one of the reasons why I think it's dangerous, very dangerous, for that to be somebody's clinical mental health framework is because the world is a very nuanced and complex place. It's grayscale. You can't afford to be a mental health provider and have a very myopic, unidimensional, all or nothing, black or white view of the world. Your view needs to be very balanced. It needs to be wide, deep, open in order to function as a clinician. Your degree and your licensure does not give you free rein to just, okay, well, now my opinion's valid because I have some kind of professional credential. So my worldview is this. Now I have some authority to stand upon. It's like, no, the authority that you're standing upon is like the sensibility of your constitution and the sensibility of your thought process and the logic and rational thinking behind your mindset, not your credentials. Let's not make the mistake of thinking that people with advanced degrees or some kind of credential are somehow superior in their opinions or views. That's the farthest thing from the truth. Flipped in the opposite direction, clients' interests and therapists' political views, it's pretty irrelevant. Political orientation shouldn't have much bearing on a person's ability to use clinical skill or provide treatment. I've seen patients doctor shop with therapists. A lot of times people will pick them because they want somebody to validate their worldview. But if their worldview is distorted, that's not helpful to anyone. And you should be able to be a good fit with your mental health provider. You should feel that they're not judging you and that you can trust them and all of those things and that there's mutual respect. I think a therapist should be a little bit like a personal trainer. You might not much look forward to going and seeing them because they should be like somebody who's comfortable challenging you, comfortable with you being comfortable with your suffering while helping you navigate it. I've heard cases of people going to 5 different therapists until they finally find one that has just as skewed as beliefs as they do, so that they can go back to their husband or their wife and say, yeah, I talked to my therapist, and my therapist says that you're the problem in our relationship. Yeah, after they've went to 5 or 6 different ones and they found another one with a personality disorder just like them. That happens, believe me. That's my unpopular opinion of the day. That should be a popular opinion. Savage Psychotherapist, out.